Okay. Now, why did you choose needle over other diagnostic, paraclinical diagnostic procedure? Meaning, why not the open biopsy? Dr. Bawa.
Doctor, I would like to correct my statement.
Go ahead.
I will do an open biopsy of this patient.
So the same question is being thrown to you. Why? And why not needed?
This is Dr. Cristobal, Dr. Harper.
Okay,
I'd just like to help Dr. Buak
Okay,
make some corrections.
Okay.
The question was if there is a negative mass on nasopharyngeal, so nasopharyngeal area, so the consideration now is a malignant parotid tumor. If this is a malignant parotid tumor, the next thing I will do is to do already an excision of this parotid gland. I would not do any further paraclinical procedure.
Okay. Suppose the scenario is that you're not sure. It's still a toss-up between malignant parotid tumor and a metastatic nasopharyngeal cancer. So what paraclinical diagnostic procedure will you do? Sunny? Did you get the question, Dr. Cristobal?
I will repeat, Doctor.
Now, in spite of the negative nasopharyngeal cancer, you're still entertaining the possibility of metastatic nasopharyngeal lymph node on the neck. Okay? So, let's say for the moment, you are considering these two, okay? Malignant parotid tumor or a metastatic nasopharyngeal cancer. Okay? So, if you were to if somebody asks you, do a paraclinical diagnostic procedure to clear up some of your uncertainty, what diagnostic procedure would you do?
Now, I will do paraclinical of needle aspiration biopsy.
So why not an open?
Because you're not sure, because the management of nasopharyngeal carcinoma is not open, is not an excision or open biopsy.
Okay. So let's hear an opinion from Dr. Manny Ramos from Tondo.
We are thinking along the line of the premise that I am not certain. Since I'm not certain, I would be on the paraclinical diagnostic stage. And I would choose aspiration biopsy with cytology. Why? Because number one, it has a sensitivity rate of about 95%. It has a high yield in metastatic lesion. Number two, it is an office procedure, very easily could be done in the office. Number three, it will definitely change my management. If it turns out to be a nasopharyngeal CA, then my management would be radiotherapy. And if it turns out to be a malignant parotid tumor, then a surgery would be warranted.
Okay, so I guess you all agree that the needle biopsy should be the paraclinical diagnostic procedure of choice. So it's just a matter of how you reason out why you choose a needle biopsy over an open biopsy. Any question from Zamboanga side regarding the last question? Okay, can we proceed to the next question? What are the general indications for doing a paraclinical diagnostic procedure? Can we hear from Iben?
The general indication for doing a paraclinical procedure is this, when you are uncertain of your diagnosis.
Okay, so can we hear from the resident from Tondo Medical Center? So,
Well, my general indications are that if you are not sure of your diagnosis and if your there was a change in management.
there will be a change in management. You want to add something, Arnab? Same. Any reaction from the residents from Zamboanga?
Can you give a reaction?
Hello, Doctor. This is Maya. I'd just like to add on what Dr. Kalumba said about not being certain about the diagnosis, and also what your resident over there said. There's a difference in management. So the difference in management, concerned about the mutilating procedure, this will be part of your management, then it is a must that you should have a pre-treatment diagnosis.
Okay, thank you, Maya. Any addition from the side? Yes, Ryan?
This is Dr. Cristobal. I'd just like to add more of the general indications to request paraclinical procedures. One is, as mentioned by Dr. Kalumba, if you're not certain. And the other one is, even if you are certain that if you do a procedure that is mutilating, you have to request for a paraclinical procedure. And the other one is, even if you are not certain, but if your management is the same, you don't have to request for a paraclinical procedure.
Okay, thank you, Sami. Anything else from the side? No more. The next question, what guidelines can you give regarding the selection of a particular paraclinical diagnostic procedures? In other words, you have, suppose you have different possible choices, options for a paraclinical diagnostic procedure. Now, what guidelines would you use? Can we ask Rex about?
I think number one is if it is rational, the cost effectiveness of the procedure, and the possible complications.
Cost effectiveness, rationality, and possible complications. Any reactions from Zamboanga side?
I would like to also do the availability of the procedure.
Availability of the procedure. Okay, anything else?
This is Dr. Anakan. I would like to add another sensitivity and specificity of the procedure.
Okay, sensitivity and specificity of the procedure or accuracy. Okay, Dr. Richard Acevedo was about to say something, but Jan Anakan has spoken. He actually expressed what Richard was about to say. So some of the guidelines which you mentioned are accuracy in terms of sensitivity and specificity, availability, complications, or risk.
Excuse me.
Yes, go ahead.
I would like to introduce to you other members here, our present. We have here Dr. Almond Tuno, who is our medical, chief of medical clinics. We have also the medical students from the Zamboanga Medical School Foundation. And we have also one junior resident, first-year resident, Dr. Enriquez, Minili Enriquez.
Minili Enriquez. Did they just come in, Dr. Srega?
Yes, they just come in a while ago.
So, what part did they touch?